briefing. Today we have our state epidemiologist, Dr. Angela Dunn. She will begin. She'll be followed by Governor Gary R. Herbert. Then Greg Bell, President and CEO of the Utah Hospital Association, will join us via Zoom. Thank you.
Good morning. Today, we are reporting an additional 3,919 new cases. Our rolling day 7-day average of new cases is 2,738, and our rolling 7-day percent positivity is 23.2%. The capacity of our referral hospitals and their ICU beds is at 87.5%. We're 4 days in to the new state order and our hard reset. We do need to give these measures time to see an impact on our case counts. However, we know that COVID continues to spread throughout the state, throughout all of our communities and all of our age groups. It's not one particular population that is experiencing the spread. And I will tell you that our only hope for slowing the spread of COVID and protecting our hospitals is if each one of us is wearing masks way more than we're doing it now. If you think you're wearing a mask most of the time, even you need to wear it more. And we only need to have close interactions with those who live in our household. We all desperately need these things to happen right now. Amongst these incredibly high numbers, we have been seeing some elements of hope. Part of the state order that was issued on Monday was to test all those involved in the high school football playoffs. Yesterday, we tested 1,360 individuals. These are players, coaches, trainers, drill team, cheerleaders, and we only identified 49 positive cases. This is a percent positivity of 3.6%. You know, and we've heard strong anecdotal evidence that kids who are participating in these football programs are taking COVID precautions very seriously. They're physically distancing, they're associating socially with only a few number of people. And yes, they're doing this to protect their football season, but this is very clear evidence for the rest of us that these types of behaviors work and that they need to be applied across all of our lives. And I can't believe I'm about to say this, but we all need to start acting like high school athletes. They have something they care about, and they're protecting their ability to keep playing. So find that thing that you care about as much as these athletes care about football, cheer, and drill. Thank you.
Thank you, Dr. Dunn. And thanks to all of you. Again, we appreciate the media. We hope that these briefings that we do weekly are helpful, informative. We want you to be able to come to the state and make sure that you get good information without any spin. The facts are what the facts are, and that will help inform us all as far as what our conduct should be in trying to slow the spread and stop the spread of this pandemic and this COVID-19 virus. So we appreciate the work of so many people who are trying to do their level best to help us all do the right thing. As been mentioned, you know, we have a significant increase in case numbers today. We'll talk a little bit about that as we go through the process here. And really this increasing infection rate, the positivity rate, which is now about 22%, should cause us all concern. And that's the reason we had a state of emergency declaration, really because of the impact that the infection rates are having, the positivity rates, and more people getting sick, because it's impacting our hospitalization capability. The rooms, particularly the intensive care units, are getting to the point of being overcrowded. And so we declared a state of emergency to address that very issue. And with our record case counts today, last week and this week now, another record again, it should cause us all to take stock in what are we doing individually to help do our part to slow this spread down. Anytime you have more than 400 people in our hospital that have COVID-19, that's the benchmark that causes us concern. we have about 468 in there today. And so, again, we're at the breaking point and ready to have some serious repercussions because of that challenge. Unfortunately, we're not surprised at the numbers. We see the trend that's occurring and the infection rates taking place in this rapid spread of COVID-19. As we've mentioned before and reported in the media, we met with Dr. Burke and Dr. Redfield from the CDC here about a week and a half ago. And when we met with them, we had case counts of around 2,000 at the time. They were prompted to come and see us because of our high rates of infection compared to other parts of the country, and wanted to know what can we do to help you. And so we had a great conversation with them, and they are going to help us with increased testing capability and making sure we have testing abilities here to increase. And that's part of our goal, to increase more testing, and particularly our college students, those that have our vulnerable populations, to make sure they're being tested correctly. And that's going to be ramped up. But when they were here, we had 2,000 cases. They said at the time, don't be surprised if we get to 3,000 cases a day. And we did that within 1 week. And now here we are a week after that we're at almost 4,000 cases in a single day. And that's a rate of infection that really is stunning. And it has real effect on our hospitals. If we look back in time, just to kind of see the trend that's taken place, it took us 9.5 weeks to get from 35,000 cases to 70,000 cases, to double. 9.5 weeks. It took us 6.5 weeks to get from 70,000 to 140,000 cases. So again, we're accelerating the case infection rates. We're not declining. Again, that we should all be concerned about that and ask ourselves, what can I do? What can we all do together collectively to slow that down? We know with these case numbers that 4.5% to 5% of them will in fact test positive for COVID-19 and end up in the hospital. So again, that's just the math. If we continue to double our cases, we're going to have some real ramifications in a negative way of this surge that's now going to hospitals. Now, people can talk about, are we gaming the numbers, or this is not right, or the math here. But what is not indisputable is the number of people that are feeling sick enough that they're going to their doctor and then going to the hospital to get treatment. So those numbers should be alarming to all of us as we look at the death rates and those who are being hospitalized and the overrunning of our hospital system. So with us to kind of talk about that in some broad arena detail, we have Greg Bell. I think through the miracle of technology, Greg Bell, who's the CEO and president of the Utah Hospital Association, speaking for all the hospitals in the state of Utah and the concerns that they have. They're the ones on the front lines that have to do the work. So Greg, are you there?
I'm here, Governor. Can you hear me?
I can hear you. You take it away now for the next few minutes.
Thank you. Well, Governor, thanks for your leadership. The hospitals have been conferring with the governor for several weeks about what interventional measures could be taken. We have long felt that a mandatory mask mandate was the absolute foundation of any public health address of the problem. So thank you, Governor, for your order. The other legs of that stool we have felt are population level testing, which is going to be rolled out under your program at universities and in some degree in high schools. And then the other thing was a social pause where we stick to contacts among our household and avoid all other social contacts and other contacts as far as possible. Of course, the question always is, the gun is pointed at the hospitals and particularly the ICU capacity. Hospitals operate under three different standards. The first one is normal care, where anybody can walk in and get care for whatever. The next one is contingency care. We've been in contingency care for a few weeks now, and by that I mean that we have expanded every possible resource. We have enlisted every nurse, doctor, and technician who's expert in treating this. We've created temporary ICU beds. We've opened beds in an orthopedic hospital in Intermountain's case. We are load leveling, meaning that we're transferring among hospitals. So Intermountain is transferring to LDS cases that could be treated there and to other facilities. And then we're also load leveling among systems, and that really started last week. So the big news is that we stood up our transfer center among systems, about 10, we've been operating it, but we in earnest began transferring patients about 10 days ago, and we've had 13 patients transferred, and that is that meaning that if an ambulance is on the way to hospital A and they're full, then they will divert that patient to another hospital who has capacity. So we watch the hospital capacity daily, and then we make those transfers. So that's not an ordinary procedure. So that's an extreme contingency measure, hoping to load level before we overspill every hospital's capacity. The other thing that we need to mention is that hospitals are adding additional teams. They've added every possible team they can. The University of Utah has added 2 or 3 teams. So where does that leave us? Hospitals report to us not just a numerical number on bed usage, but on the general capacity. In other words, how are they handling the load now? Because they may not get nurses showing up. They may have people out ill. They just don't have skilled crews, and that's not uncommon. ICUs typically operate on an 85% capacity. That's full for them because just changing patients, requirements for PPE and doctors, and just the churn, it's hard to get above 85%. We're above that now. Some hospitals effectively are at 100%. These are referral center hospitals. We have some capacity. We're still treating all comers, but if we keep admitting 90 to 100 patients a day, then we just can't handle that, certainly in the ICU. Now, if you were to be denied an ICU bed, would you get care? Absolutely. We have still a lot of room in our general wards, in our med surge, and in our even in our acute care. But in our intensive care units, we're right on that line where we're effectively full. Thank you, Governor. I'll hang around for questions.
All right, thank you, Greg. I know some of the concern is not just only the number of ICU beds, but it's the personnel. Have people that staff it. These are positive pressure rooms in our ICU units. They're not like a traditional hospital bed. So it's having those that have the right equipment and resources in a room, especially designed for intensive care, as well as those that have to man it, the personnel. I did note, Greg, that we saw Intermountain Healthcare has hired on another 200, I think, nurses to help augment the increasing demand that they have in their hospitals, and I expect others are probably following suit. With that, let me just say, again, the cause for alarm is because of the trend that's taking place, that more people are getting sick, and constantly more people are going into the hospital for treatment. And we appreciate those in the healthcare industry that are doing so much to treat our folks. They are on the front lines, and they are really the first responders and really putting their own lives on the line as they, in fact, treat people. And we see some of them that also do get infected and have their own problems with COVID-19. So we thank those in the healthcare industry for all the work they're doing. We do need to stop this alarming trend, and it certainly is a trend. We see the numbers escalating, and that's why we have a public health order today in place to help us, if nothing else, to remind us of the seriousness of the issue and to encourage us all to follow the guidelines that really we've not made up in government. these guidelines are coming to us from healthcare specialists, those who actually know what's taking place. They are experts in the healthcare industry. They are certainly learned along the way these past 8 months here in Utah as far as what the pandemic is about and what COVID-19 does. We've learned better how to treat it. We have better treatment now than we did in the beginning. And I think that's helping us to have less mortality. But we still have people that are dying from this pandemic. And so to review the requirements that we've put in place, again, we ask people to wear masks. Certainly when you cannot social distance. Again, social distancing, being away from somebody who has the COVID-19 or potentially has COVID-19 is the best thing you can do. But if you can't social distance, you absolutely should be wearing a mask, and that's a requirement we have throughout the state now. And we hope people will follow this good, sound medical advice. We had the fellow from Brigham Young University. They've reviewed 120 studies across the country to remind everybody. And although they went in thinking it would be 50-50, they came back and find that 95% of the studies do show that you will minimize your risk of catching COVID-19 if you're wearing a mask. And that's for all of us to wear a mask because, as we've said before, I wear it so I don't give you the COVID if I happen to have it, and you don't give it to me if you happen to have it. It's a two-way street. So again, wearing the masks work, and you should have one on at all times. If you're around other people that you particularly don't live with, you should have a mask, and if you can't social distance, always have a mask. Two, we talk about casual gatherings. The data informs us that the area where we're having the most rapid spread and the most highest rate of infection is, in fact, in our casual social gatherings. Not only our young people, but it's in these environments where we're used to doing it. It's part of life. I understand getting together and hanging out with friends and family is what we do. But unfortunately, that's the most risky gatherings that we have. And so we're asking you, certainly for these next 2 weeks, since Monday, we started this, for 2 weeks to, in fact, limit your social gatherings to just those of your immediate household. I know that's asking a lot. That's harder, I think, than wearing a mask. But we ask you to be careful and cautious because that's the risky gatherings that are accelerating the spread of this coronavirus. At least to try to do that until the 23rd, which I think when our 2 weeks end up. So that's number 2 on the list. 3, we've in fact put on a pause on most all high school sports and activities after school. And again, we're finding schools lining up to help with that. We have a lot of support from people out there. Again, this is a 2-week pause, and then we're going to work with our superintendents, our school boards, our teachers to see what we can do to bring back activities after school in such a way that we can minimize the risk. And so, but for the next 2 weeks, high school sports and extracurricular activities are on a pause. And last but not least, I mentioned earlier about testing. We really are committed to ramping up testing, particularly for our college students, that age group between 15 and 24, which has on an age group category the highest infection and transmission rates. So we're going to ramp up our testing opportunities. By the end of next week, thanks to Dr. Redfield and Dr. Birx and the federal government and the CDC, we'll have sent 100,000 rapid antigen tests to colleges, universities, and trade schools. So we're going to ramp up significantly our ability to test certain categories of our population. Again, we appreciate the work of many to help this to happen, and that's going to continue to ramp up. We hope that over the next couple of weeks, we can ramp it up from not just 100,000, but to be able to test 250,000 a week. And the ability for us to find out, particularly those who maybe are asymptomatic, and find them and isolate them before they, in fact, infect other people will go a long way towards us slowing down the spread and the infection rates that we have today at now nearly 22%. So we applaud the efforts of our colleges out there to participate in this effort. They're lining up. They're certainly uniting behind this effort, and some of them are actually purchasing their own tests to get a jump on this, and are doing some good work already. So we thank them for their engagement. Over the next 2 weeks, let me just ask you all to be patient. I know it's sometimes hard to do with what we're asking. I understand that. But it's going to take a couple of weeks to see if what we've put in place actually has any kind of an effect. 2 weeks is kind of the quarantine period for the gestation for this virus to develop. But I certainly believe, and I've believed it from the beginning, and I believe it still today, that if we all do our part, if we're all invested and enlisted in trying to do our part to slow the spread, we can actually do it. We can get on top of this. That's a personal challenge for all of us. And I'm hopeful that people will unite in this effort and do your part to slow down the spread. Let me just say too that we tested about 1,400 people in our 12 high schools here the other day and found 53 approximately that had positive tests. They were asymptomatic. They showed no signs. That's an example of how this testing will work and help us to find those who have it, don't know it, get them out of the middle of society, isolate them so they don't spread it. And that'll help us to slow down the spread and eventually stop this from growing like it's done, and turn flatten the curve and reduce the hospitalization needs. Eventually, I do believe that we'll get on top of this, that we will slow the spread and the positivity rates will in fact drop. But it will only happen as we change behavior. That's what we all need to do, and whether it's a government regulation, mandate, or just we do it of our own free will, it's going to be the modification of behavior that's going to help us, in fact, get on top of this pandemic and slow the spread and flatten the curve. It's going to take some time for this to happen, but I do believe we're going to work through this as we have done other challenges in our history. Certainly the Spanish flu of 1918 and 1919, we worked through that and came out. This will be the same. I'd like to see it done quicker rather than slower, and sooner rather than later. So the good news is I believe that if we all have patience and fortitude, we'll be able to get to the point where we have a vaccine. There is a lot of encouragement in the medical community about a vaccine, and maybe more than one that's being developed by people in the medical expertise involved with vaccine development. I believe that in Utah, at least, in the next 4 to 5 weeks, we will have a vaccine here that we'll be able to give to those and some kind of a priority list to be developed. Those who are our healthcare providers on the front lines will be treated. Those who are vulnerable in our populations will be treated. Those who underlying healthcare issues and those over 70. So we're going to have the opportunity to see this happen and unfold here, hopefully, and sometime in December, certainly by the first of the year. And that will continue to grow and expand until we have it for general distribution, I believe sometime in the month of March, 1st of April. So again, there is in fact daylight out there, and I think hope for us to get through this and get on top of it so we get back to more normal socialization and more normal lifestyle. I think that will happen in 2021. The vaccine is going to be a big game changer for all of us. So with that, we're happy to take a few questions for a few minutes, and we'll open that up for Dr. Dunn, myself, and Greg is still on the phone.
Hi, Governor. This is Wendy Leonard from Deseret News.
Yes.
This state of emergency is set to expire just before Thanksgiving in Utah. We've seen New York and possibly other states setting limits for holiday gathering sizes. Is this a possibility in Utah, or what are your plans for that?
We are working with our healthcare experts and to find out what are the recommendations that we should give to people with the upcoming holiday season, Thanksgiving, Christmas, New Year's, those kinds of gatherings. We know that's traditional for families to get together. And we'll give some detailed things. We're working with the CDC that has some guidelines out there. It probably will become more of a what's the risky thing to do as opposed to the non-risky thing to do. Clearly, as we travel and get away from our homes, and whether people travel into our communities or we go to their communities, that's a higher risk factor. As we gather in large groups of non-household members, that's a higher risk factor. If we don't wear masks and we don't social distance, that increases the risk factor. So most of the things we do are going to be measured by how risky the gathering will be. And we're going to give you some ideas of what you should do before Thanksgiving, during Thanksgiving, and after Thanksgiving. So we'll give some more detail on that this next week.
Hi, Governor. Just wanted to ask, with all the schools switching to remote learning only recently and our numbers being so high, at what point would you consider temporary closure of public schools in the state?
The policy we've put in place is being followed, and we appreciate the work of superintendents, principals, the school boards, which have to make the tough, difficult decision. We all recognize how significantly important it is to have our kids in school learning. And we know that online learning is possible. It's better for some than for others. And we think overall, we believe that's probably not as effective in learning as opposed to being in the classroom with the teacher. That being said, under our program right now, those are local decisions. They know best what's taking place in their jurisdictions. The the local school boards, we have 41 of them, know the issue better than anybody else. And so they're making those decisions whether they should go online or hybrid or what the situation should be. That being said, we're going to work with those school boards. Again, we have accumulation of data to make sure that we're being informed by data, that the data will drive us as far as what we should be doing and what they should be doing. So there's still some discussion for us to have as we have now an accumulation of data, and we'll take a look at that and work with them and maybe have more on this in a future press conference.
Hi, Governor. It's Ben Winslow from Fox 13. Just wondering, with your order set to expire on November 23rd, is that enough time to have conclusive data about the effectiveness of your public health orders? And are you?
Well, Ben, the 2 weeks that we put in there didn't just come out of the sky. That's really the incubation period for the coronavirus. And so if we in fact change our behaviors, we would think we would see some indication that it's working. It may be a little short. We're trying to in fact get it through. Part of our motivation was to have this in place before Thanksgiving and the holiday season, because we know that's going to be a harder time to keep people apart. Again, it's part of our culture to gather together with our families and friends and on a Thanksgiving weekend. So that's part of our motivation. We'll have to wait and see. I'm hopeful, I'm optimistic that people are actually modifying their behavior. I think we see more people out there being sensitive to others by wearing a mask, showing respect and civility in that process. We see businesses stepping up and joining with the stay safe and stay open, making sure that they're doing the right thing with their employees and with their customers to help it be a safe environment. So we see modifications of behavior. The question is it enough? I guess we'll have to wait and see, and certainly we can make modifications as necessary. I hope that we can actually go back to more normal and not have to have more government restrictions placed upon us.
Hi, Governor. This is Sonia Hudson from KWR. I'm wondering what your reaction is to some local authorities, thinking about Iron County Sheriff in particular, not enforcing the new statewide restrictions. I mean, what kind of impact does that have? And, you know, what good does having a statewide mandate do if local authorities choose not to enforce it?
Well, it certainly lessens the impact. Again, law enforcement's designed to be there to, in fact, enforce laws. They don't create laws. That's done through a legislative process or through statute, through what the process set up by the legislature, which is what we're doing. All the efforts we've made have been, in fact, I'll throw a shout out to Channel 13, Fox News, did a 5-minute session on, does the governor have the authority? Does the State Department of Health have the authority? The Labor Commission have the authority to put in place the rules and guidelines that we've put in place that we announced last Sunday night. And I appreciate the fact they did an in-depth review and study of that and came back and said, yes, the governor does have the right and authority under our Constitution, our statutes, to do what he announced Sunday night. In fact, they went on to say he could even do more if he wanted. So I hope everybody understands we're doing things under the guidelines that are set up by our Constitution, by the statutes of the state of Utah. This is not something we want to do. It's something that our experts in health and science and the data understand pandemics are saying this is good policy. This is what will help us, in fact, fix the problem. So that's where it's coming from. It's not really coming from my office, other than we're getting recommendations from the best and brightest of the state of Utah. And so having anybody say, well, we're not going to enforce it, does not help. Clearly, that's not their prerogative. They should, in fact, do the best they can. And we should expect people of Utah to, in fact, follow the guidelines that have been put in place and honor, obey, and sustain the law. That being said, one of the things that was mentioned, which I thought was disappointing, I'm going to ask Greg Bell to talk about this. One of the comments that the sheriff made was, we reject the guidelines for a number of reasons, thinking that they don't work. And one of them that they said was, we have plenty of hospital space in our hospital in Cedar City. And Greg, I guess I need to ask you if that's in fact true, and set the record straight, or confirm what the sheriff down there said about the hospital in Cedar City. Greg, can you hear me? Greg? He's not on the call. He's left. Well, I can tell you that what we're finding is that we have hospital beds out there, but as I mentioned earlier, they're not all the same. Not all hospital beds are created equal. And the fact of the matter is that we have what's called load leveling. People from Cedar City are being transferred when they have acute needs to other hospitals. They're taking them to get the best quality health care they can get. And unfortunately, that's going to come to a screeching halt as we overcrowd the hospitals, and there won't be room in Cedar City for people that have COVID-19 and other acute ailments and need of ICU beds. So again, we need to listen to the experts out there when it comes to medical care and hospital care, and whether we have overcrowding or not. Disinformation, misinformation is not helpful. All right, we'll go to the next question.
Sorry, go ahead.
Next question.
If I could just follow up briefly on that. I mean, if you say this is not enforcing it is impeding the progress that our state could make. Do you have any plans for, ensuring that local authorities do in fact enforce this statewide mandate?
Well, what I would hope is, again, I'm a big local control guy. We've really had that as a kind of our efforts from the beginning to let local people make those decisions. We still believe that's the best way to do it. And so I'll leave it to the people of Iron County to make that determination with their elected officials, what they want to do. I don't think we're going to see anybody run down there and start enforcing the law in behalf of Iron County from outside their jurisdiction. We just hope that the facts and the data will inform them as far as what to do. We're all in this together. It doesn't have to be adversarial. We want to find a way to get through this pandemic and find a good outcome. We want to protect people's health. People that have it have not liked having it. Some have a much more severe reaction than others, and we understand that gradation. But some people spend time in the hospital and it's not pleasant, and some people die. We want to do this in a way that we have minimal detriment to our health. At the same time, we also are cognizant about the need to have a healthy economy, as healthy as it can be. And so we're doing this in conjunction. So again, we should not be on opposite ends of the spectrum on this when it comes to our goals and objectives. We want to protect people's health and have a healthy economy. And we're doing a pretty good job, all things considered, in the state of Utah in that regard. So I hope that all of us can pull together rather than find ways to divide us.
Good afternoon, Governor. Brian Malahy here. A couple of questions for you. I spoke to Dr. Deborah Birx again this morning, and she said a couple of things of note. One, in the UK and also in southern states, they closed bars and gyms, and it was effective. And she thinks bars and gyms should be closed in Utah before schools. So I'd like to get your reaction to that. Second, she said that people in Utah should not gather with their extended family members, this is her recommendation, until after the new year. Do you agree with that recommendation?
Well, let me just say, we respect the recommendation from Dr. Birx. Again, she's seen a lot, not only in our country, but around the world, and probably has gleaned a lot of information from those experiences and contacts. I am a believer that Utah should do what we think is best for Utah based on the data and the information we have. It is not a one-size-fits-all situation. We see what's happening in other states. They're having actually some significant challenges. I look at South Dakota and our friends up there that have the highest infection rates are not doing anything. And if we followed their lead, instead of having 660 deaths, whatever the number is today, we'd have about 22 to 2,300 deaths in Utah. So I don't want to follow that model either. So again, some people tout that as the best. New York's in a good place now with their case counts being down and low, but their mortality rate is about 170 per 100,000. Ours is 15 per 100,000. So I don't know that I like their model either. So we'll find the model that works for us. We did put on the table about bars and gyms. And we have found, at least based on the data, that if people will in fact social distance and have a mask on, there's not a significant increase in infection rates. Our business community actually has been a remarkable effort. And they're motivated because they know if they don't have customers, they don't make any money and they'll be out of business. So they're trying to make a safe environment. So our businesses are doing good. That's really not one of our major areas of spread. It's the casual getting together. And that's what Dr. Birx is trying to get us to do through the first of the year. That has, I think, more legitimacy as far as the data being to back up her position than the other. And that being said, again, we've put that as a 2-week order. We're trying to get people to modify their behavior and take a more cautious approach, a more less risky approach. But we'll have to wait and see what happens after these next 2 weeks and see if that's something we want to recommend or not. And that's yet to be determined, I guess is what I'm telling you.
And are you speaking about bars and gyms yet to be determined, or?
No, bars, yeah.
And what about, I'm sorry, go ahead.
I'm sorry, Brian. What I meant to say was the business community is doing good. We don't see a large infection rate. The businesses are doing well, doing their part to slow the spread. And that goes also for gyms and bars. I know that's been something that's been done across the country. Our folks here have done a good job of our gyms, of sanitizing the apparatus. We've told them they can stay open if they maintain social distancing. They don't have to wear masks when they're exercising and breathing, but they have to maintain social distancing, and they have to sanitize the equipment. And the data would seem to inform us that if they do that, they're going to be okay. They won't have a big surge of infections. Same with bars, although we do find that the consumption of alcohol, for whatever reason, seems to in fact cause people later in the day, into the evening and the night, be a little more socially close. And so we're letting them stay open under the same provisions that we have restaurants. Again, social distancing, mask wearing, except when they're consuming. And we'll see how that works out. But we wanted to make it kind of a level playing field between, we have bars that are restaurants and restaurants that are bars in the state of Utah. And so we think that's a Solomon-like way to address those issues. So that'll stay the same.
And what about her, I'm sorry, go ahead. Apologize.
Well, I was going to say the second issue is, I think, your casual gathering of members of your household. Yes, and that's part of our 2-week order. We've asked people to do that, and we'll review that as we get through this 2 weeks and see if that's something else we'd like to extend or not. I think it's so contrary to the culture of Utah. Thanksgiving is a gathering time for families to get together. As I mentioned earlier, there are kind of risky behaviors that you can eliminate by not traveling, by wearing masks, social distancing, only engaging with members of your own household. We're working on that to see what recommendations we'd make. We'll probably give those next week, in a week in advance of Thanksgiving. and we'll be talking about not only Thanksgiving, but Christmas and New Year's at the same time. So we want to have, our goal is to have people enjoy the holiday season, but also have a safe, enjoyable holiday season. And following the guidelines that we'll recommend will help them to have that. So more detail probably will be forthcoming here this next week.
Thank you.
Next question.
Hi, Governor. It's Courtney Tanner here. I'd love a response on this from both you and Dr. Dunn, if that's possible. My question is, should we be treating high schools differently? Last night, we saw Jordan School District temporarily close 5 high schools. Some of those for a second and third time. 50 high schools in the state have had to transition online. High school students are obviously in that 15 to 24 age range. They have jobs, they socialize more than elementary students. What should we be doing with high schools and the spread with those students in particular?
Why don't you take it first whack?
So what we've learned from testing the high school athletes is that high school students can prevent spread within their own social circles, right? They wear masks. If they limit the number of people that they're around socially, there won't be spread among that population. And so that's what we need to keep focusing on. What can we do to ensure that that population continues to adhere to masking and physical distancing? We are working with healthcare experts across the state to look at risk among age groups. And we know that the risk is lower in elementary and middle school, and that spread is higher in high school. And again, it doesn't matter what environment they're in, whether it's school, social, sports, that risk is still there. So across all of those environments, they need to be masking and physical distancing.
Let me just add to that, I think in many instances that being at school where there's a controlled environment, particularly for our younger age kids, who are very diligent at wearing the mask, and the teachers have oversight. They're doing a good job at their eating at the cafeteria when they have lunch breaks. We're finding that's really been a pretty safe environment. So we need to, in fact, continue to do that. Our high school students are a little more independent, a little more casual. Again, sometimes they have the mask, but sometimes they're not wearing it correctly. We need to get them engaged. I certainly believe there's kind of not a one size fits all. Some are doing it better than others. We're trying to make it fair and equal for everybody across the board. That may be asking something that's impossible to do, but we're trying to make sure everybody's treated the same and has the same opportunities and the same requirements. So again, we trust the superintendents of the districts. We trust the principals and the schools, the teachers. We certainly trust the elected school boards to make the appropriate and proper decisions based on their information for their respective school district. So all 41 are not going to be the same. And we allow that local control, and so we'll see some differences. But again, we'll probably homogenize as we get more data and more information as we're learning as we go. The evolution of this has been dramatic, and it continues to evolve as we get more data and more information, as we learn more about the Corona-19 virus and how to treat it, the therapeutics, what works and what doesn't work. And so you'll see a continued evolution, I believe, as we go over the next few months. Last question.
Hi, Governor Herbert. This is Sophia Eppolito with the AP. I have a couple questions related to testing for both you and Dr. Dunn. I'm curious to Dr. Dunn what our current testing capacity is, and with a percent positivity rate as high as our current one, how many people would we need to be testing per day or per week to get a surge like this under control? And to you, Governor Herbert, I'd ask, I know a few months back there were talks about expanding testing not just to those with symptoms or have had confirmed contacts with people. I know we're expanding it in college students, but is there a goal to expand testing to whoever wants a test? And when might that happen?
So we're testing nearly 10,000 individuals a day with a percent positivity above 20%. That means that our spread is outpacing our ability to test. So we are all hands on deck, focused on getting rapid testing out to as many people and populations as possible. That is going to be a key to slowing the spread. The caveat there is that there is a really shortage of rapid testing right now across the nation, because Utah isn't the only state experiencing the surge. It truly is nationwide. And so everybody needs these resources So they're being divvied out at the federal level. I have heard that there are a couple new rapid tests coming on in the coming weeks, and that will hopefully increase our ability to roll that out more quickly and more broadly. But it is certainly a problem we are trying to get a handle on right now, but of course have a lot of limitations with that. We do have the ability to do PCR testing with our local labs. The amount of people that are positive right now and the number of close contacts and symptomatic individuals we have is creating a delay in even getting an appointment to get tested because we have so many cases. That means there are a lot of close contacts out there and a lot of people with symptoms that need to get tested, especially as we move into the winter season and people are having kind of these generic fever, malaise, feeling tired, and cold-like symptoms that could be COVID. So testing, once again, is at the forefront of our mind, and we're working hard to overcome the limitations we have currently.
Let me just add to that too, that I think this rapid testing capability, this Binex antigen test that we have, the one that I am thinking in my mind is produced by Abbott Laboratories, where you can have minimum invasion with the swab and really know within 20 minutes whether you have the infection or not. That really is in many ways a game changer. Rather than have to wait for a couple of days to get your test back, we can know almost instantaneously whether you have the COVID-19 and then start isolation to help slow the spread. So again, one thing that we in the legislature are really on board together with is increasing testing. We think that is in fact a significant need for our state. As you heard Dr. Dunn talk about this, that's how we're going to get on top of this and turn the infection rate around. So I appreciate the fact that based on what we're getting from the CDC and the federal government, we'll have, in addition to our $65,000 a week allotment, we're going to have another 100,000 that will start coming in next week. It will allow us to go to 165,000. And then hopefully the week after that, we're going to be able to get up to 125 and 150. So our goal is to, in the next few weeks, to be able to test 250,000 a week. Again, as we bring on our students in college, where we have significant spread, as well as those in high school, we're going to be able to test them more. And that means not just those who have symptoms, but those who are asymptomatic, which we're finding have a significant impact on the spread of this virus. Those that don't know they're sick and, innocently out there spreading the virus to other people, and that gets spread to somebody else, it gets spread to somebody else, and it gets spread to somebody who's in a vulnerable population, and we have a real problem with the overrunning of our hospitals. About those who have the infection, nearly 5-6% of those people end up in the hospital. So that it's a math problem. So we've got to get this infection rate turned around. Testing is going to help us to do that. With that, let me thank everybody. Again, the plead is to all of us to do our best, do what we can. This is more about personal responsibility and respect for your fellow man and doing our part than it is about any kind of government mandate. But together we can, in fact, find the solution and change this and get on top of it so that 2021 will be a more normal, back to normal year where we'll have social gatherings as we've had them in the past. So thanks for your effort. Thank you very much.